Welcome to the Expert Roundtable podcast, where we connect frontline clinicians with top thought leaders to facilitate discussion on key issues they face daily.
This is Expert Perspectives in Rheumatoid Arthritis, and we're honored to be joined by three experts in the field, Dr. Ruderman, Dr. Weinblatt, and Dr. Wiseman. Good. Dr. Ruderman, do you want to start?
Sure, Eric Ruderman. I'm rheumatology at Northwestern University in Chicago.
Okay, great. Dr. Weinblatt?
I'm Mike Weinblatt. I'm a rheumatologist at the Brigham and Women's Hospital in Boston.
And last but not least, Dr. Wiseman.
I'm Michael Wiseman. I'm a rheumatologist in Los Angeles, and currently I'm adjunct professor at Stanford University.
Wonderful. And I'm Dr. Hirochi, your host. We are tremendously excited to have each of you here today. You, for those who don't know, have been involved in all kinds of things, have essentially written the book on rheumatoid arthritis, from my perspective at least, in guideline development, clinical trials, etc. And for the audience, I had the privilege of doing a deeper dive with our guests on everything from JAK inhibitor safety profiles to synovial biopsies and spatial transcriptomics. So visit expertperspectives.com for those articles, shameless plug. But for today, the question is a simple one. As you sort of look back at your career and look forward, what are you excited about when it comes to RA and RA research?
I'm excited about prevention. I think this is the exciting area. And I think that this, we've actually prevented a lot already by stopping people from smoking, but what else can we do? What else can happen? Can we prevent it by adding a biologic drug, before the disease starts? Well, the answer to that is probably no. But I think this is the research area, prevention, that I think is the most important. What do you guys think?
I would agree with you. I think that's really important, but I do think we're still getting plenty of people who are coming in with new diseases despite, all those efforts, and it's going to take some time to get anywhere. And I am hopeful that some of the work being done on the sort of precision medicine arm may be helpful, because, right now it's very frustrating. We have all these incredibly effective drugs, and we don't really have any way to know how to use them or which drug is the right drug for which patient at which point in time. And I don't think we're going to ultimately be doing synovial biopsies on every patient to drive that. But if we can learn information from that, then it can help us identify in something more than just sort of pattern recognition description, like what makes some people more likely to respond to one drug or another. We'll be able to cut to the chase much quicker. It would be fantastic if we could, emulate the oncologist and say, look, we've identified the tumor tissue, we've broken it down, and this is the treatment approach that we're pretty confident is most likely to address the issue. I would love to see that.
Yeah, well, both Michael and Eric, I am enthusiastic about both those topics. Having spent 20 years trying to identify biomarker that can predict response in rheumatoid arthritis, I'm interested in the increasing interest on two targets outside of the joint. I'm really interested on the heart, because I think we realize that we've got to reduce the risk of cardiovascular disease in a rheumatoid patient, and studies that can identify patients at greatest risk for cardiovascular disease that require more intensive evaluation and referral to the cardiologist is the way to go, because not every patient with RA is going to need to get, a calcium CT scan, for instance. And then obviously the lung, the unforgotten organ for decades. And now we appreciate that as we make the joints better, the lung is an issue that we identify with. And, also identify, 20% of rheumatoid arthritis patients have underlying interstitial lung disease. And we've got to identify who these people are and get them evaluated, and then hopefully develop strategies to prevent progression. So we can't forget the joint, but we also need to think about the heart and the lung. We have made remarkable progress in this disease. For a significant percentage of our patients, their outlook is outstanding.
Yeah.
And, we have objective data that we've decreased the need for total joint arthroplasties in our patients with RA, which is fantastic. And patients, whether their mortality is improved or not, it's still, I think, somewhat controversial, but functionally, these people are so much better than they were even 10 years ago. But we have a significant population of rheumatoid patients that still remain with active disease that we need new therapies for.